Hello, we're very happy today to have Dr. Yiu with us. Dr. Yiu is a specialist in gastroenterology and hepatology. Today we are going to talk about stomach pain. A lot of people in Hong Kong have a lot of work pressure, and maybe that will be a cause for stomach pain. But what other things will cause stomach pain, and what kind of treatments are available nowadays?
Yeah, there's many kinds of stomach disease. One is very obvious and organic one is that the stomach can have a peptic ulcer disease. Ulcer disease is quite common, and it is somewhat related to a bacteria. We call it Helicobacter pylori. It is a kind of bacteria thought to be infected while you're eating some dirty food. So it is contaminated with the bacteria, and then they would harbor in the stomach and cause the disease like gastritis and peptic ulcer. And this kind of disease, we think that this bacteria can also cause gastric cancer too. So we need to make a diagnosis correctly and to give medication, antibiotics to kill the bacteria, and then can make the patient free from stomach disease thereafter. But nowadays, because the hygiene is better, bacteria cause of a stomach ulcer maybe is not a very prevalent issue in like Hong Kong. Another kind of problem that would make the stomach worse is the acidity. As you said, related to stress, life events. Some people have inborn to have more acid too. So this kind of acid problem can also cause ulcer or gastritis. Sometimes they even don't have inflammation. Just the acid would cause them pain. So we need to have a treatment for that to suppress the acid, and it would help the patient from this kind of disease to heal the ulcer, heal the gastritis. But the problem is that it usually recur, because when you finish the course of medication, like 4 to 6 weeks for the ulcer disease or gastritis, when you stop the medication, the acid will produce again. If the life stress cannot be changed, their social or working environment is still the same, then the acid will produce because of stress. So sometimes they need to take longer course of medication treatment. And another kind of stomach disease is also very common, is that we call it functional gastric disorder. Functional, that means the stomach have no abnormalities when we do examination on them. We do a gastroscopy and see the stomach is totally clean and normal and no inflammation. It is just kind of excellent condition on observation. But they have the functional disturbance of like the motility problem, the sensational problem. The stomach is super sensitive. It's very sensitive to your acid or just a normal amount of food. They will feel very bloated because they have an abnormal signal to the brain that I have a lot inside, but actually it's the same as those without such kind of symptoms. Both are eating the same amount, but one will think that they are very full in the stomach. This kind of abnormal signal in the stomach, because the nervous system of the stomach is disturbed. Stomach is controlled by another or different kind of nervous system, not like our brain. It would be disturbed by stress also. So if we have this kind of problem, that is another chronic problem that will recur and recur because it is also related to stress. But we have good medical treatment for that help a lot of patients to make them free of symptoms and with a better quality of life. But they may need to take a long time,
Longer
duration.
medication.
Yeah,
Okay.
just help them to have a good quality of living. Yeah.
I see. So the tips is you should see a GP first if you have stomach pain. If it's very getting more serious, then you should consult a specialist. And you should not stop the medication on your own. And you should listen to your doctor or the specialist. Okay, wish everyone a healthy life. Thank you.